Registered nurse, RN, is critical to healthcare, providing patient care, administering medications, monitoring health conditions, and collaborating with healthcare teams to ensure optimal outcomes. RNs must demonstrate clinical expertise, strong decision-making abilities, empathy, and excellent communication skills. Their role involves balancing patient needs with healthcare protocols while maintaining professionalism in high-pressure environments. Preparing for an RN interview requires demonstrating both technical nursing skills and interpersonal qualities. Employers look for candidates who can provide quality patient care, handle emergencies, communicate effectively with patients and families, and work efficiently in multidisciplinary teams. This guide will explore common RN interview questions, provide sample answers, and offer practical tips to help you present yourself as a skilled, compassionate, and confident nursing professional. Question 1. Can you tell us about yourself? Here's how you can answer. I am a registered nurse with experience in specific department, e.g., medical surgical, pediatrics, ICU, providing patient care, administering medications, and monitoring vital signs. I am compassionate, detail-oriented, and committed to maintaining high standards of patient care. I also enjoy educating patients and collaborating with multidisciplinary teams to achieve the best health outcomes. Tip: keep it concise, focus on clinical experience, and show passion for nursing. Question 2. Why did you choose a career in nursing? Here's how you can answer. I chose nursing because I am passionate about helping people and making a difference in their lives. Nursing allows me to provide direct patient care, advocate for patients' needs, and support families during challenging times. The ability to combine clinical skills with empathy and problem-solving motivates me every day. Tip: demonstrate genuine passion, compassion, and dedication to patient care. Question 3. How do you handle difficult or uncooperative patients? Here's how you can answer. I remain calm, patient, and empathetic. I try to understand the patient's concerns and communicate clearly to explain procedures or treatments. For example, if a patient refuses medication, I explain the benefits and address their fears while respecting their autonomy, ensuring they feel heard and supported. Tip: show empathy, communication skills, and the ability to de-escalate challenging situations. Question 4. How do you prioritize your tasks during a busy shift? Here's how you can answer. I assess patient needs based on urgency, severity of conditions, and scheduled treatments. I create a mental or written checklist, delegate appropriately, and communicate with colleagues to ensure all critical tasks are completed. For instance, I prioritize administering medications on time while also monitoring high-risk patients closely. Tip: highlight time management, critical thinking, and teamwork. Question 5. Can you describe a situation where you handled a medical emergency? Here's how you can answer. During a previous shift, a patient experienced sudden respiratory distress. I quickly assessed the situation, called for assistance, administered oxygen, and followed the emergency protocol while keeping the patient calm. The rapid, coordinated response ensured the patient stabilized safely. Tip: emphasize calmness under pressure, quick decision-making, and adherence to protocols. Question 6. How do you ensure patient safety? Here's how you can answer. I follow established safety protocols, including medication administration checks, infection control measures, and proper patient handling. I also educate patients and families on safety practices, monitor for potential hazards, and report any concerns promptly to maintain a safe environment. Tip: show attention to detail, knowledge of protocols, and proactive safety measures. Question 7. How do you handle stressful situations in the workplace? Here's how you can answer. I remain focused on patient care, take a methodical approach, and rely on teamwork. For example, During high patient volume periods, I prioritize critical cases, delegate where appropriate, and maintain clear communication to ensure efficient care without compromising safety. I also practice stress management techniques to stay composed. Tip: employers want RNs who can maintain performance and professionalism under pressure. Question 8. How do you handle patient confidentiality? Here's how you can answer. I strictly adhere to HIPAA regulations and institutional policies regarding patient information. I ensure that patient records are secure, share information only with authorized personnel, and discuss sensitive matters in private settings. Maintaining confidentiality is critical for building trust and ensuring ethical care. Tip: highlight professionalism, awareness of regulations, and ethical responsibility. Question 9. Can you provide an example of patient education you've delivered? Here's how you can answer. I once educated a diabetic patient on proper insulin administration, dietary management, and blood sugar monitoring. I used clear explanations, demonstrations, and written instructions. After follow-up, the patient was able to manage their condition effectively, showing improved adherence and understanding. Tip: highlight communication skills, teaching ability, and patient empowerment. Question 10. Why should we hire you as a registered nurse? Here's how you can answer. I bring strong clinical skills, dedication to patient care, and the ability to work effectively in high-pressure environments. I am compassionate, reliable, and committed to continuous learning and professional development. My experience, work ethic, and ability to collaborate with teams make me a strong candidate for this role. Tip: summarize your qualifications, clinical experience, and personal qualities confidently while aligning with the needs of the role. Final thoughts. RN interviews assess both technical knowledge and interpersonal qualities. Employers look for candidates who can provide compassionate care, make critical decisions under pressure, communicate effectively, and support interdisciplinary teams. Preparing structured answers with real-life examples helps you demonstrate competence, confidence, and readiness for the role. Additionally, professionalism, empathy, and adaptability are equally important. Speak clearly, provide measurable outcomes where possible, and show that you can maintain high-quality care in challenging situations. By combining clinical expertise with communication, problem-solving, and teamwork, you can present yourself as a capable and compassionate registered nurse ready to make a positive impact on patient care.